Good morning, everyone. Thank you so much for joining us. We are going to go ahead and get started in a moment or so as people continue to trickle in, but thank you for joining us for part 2 of our Navigating Mainstream Benefits SSI and SSDI training. So as people are trickling in, I just want to thank everyone once again. We had such great engagement and participation yesterday for part 1 of the Navigating Mainstream Benefits SSI and SSDI training, and we're so lucky to have Rachel and Becky with us from the Law Foundation, and they will be covering part 2 today. Before we get started, I'm just going to quickly reintroduce myself for those of you who aren't already in frequent contact with me and familiar with me. My name is Nicole Thomas. I'm a policy analyst at Homebase. Homebase is a technical assistance provider that works with COCs across the nation, and we do a lot of work with Bay Area continuums of care. I specifically do a lot of work with the Santa Clara County COC. We work really closely with the Office of Supportive Housing, and one of our big roles is putting together these annual suites of trainings, including a Navigating Mainstream Benefits series, which has always been quite well attended, and we're continuing to work on how to improve our trainings in the future. So we will be popping in a feedback form later towards the end of the training that we really hope you take a second to fill out, because it helps us improve and tailor our trainings and really make sure that we're getting you content and topic areas that you want to learn more about. And as I said, this is part 2. In terms of tech, I just want to note, I think you're all familiar with Zoom trainings by now, but I do want to note we are recording this training because, as always, all of the training materials are going to be sent out. So they'll all be posted to the COC training website, and an email will be sent out notifying you when those materials have been uploaded to the website. So don't feel like you have to furiously take screenshots of anything, because you should already actually have the slide deck. I sent it yesterday, but it's going to be sent out again, the slide deck, the recording, all of those materials. Because we have quite a lot of folks on the training, again, we're going to keep everyone on mute just by default, but there will be Q&A sections where you can come off of mute and share orally. But in the meantime, we really do encourage you to continue engaging and asking questions through the chat. Becky will be monitoring the chat throughout, so please feel free to do that. And then if you have tech issues, please chat me directly. I'd be happy to troubleshoot that with you. And the only other thing is closed captions are available. So if you hit enable captioning, they've been enabled. So if you hit closed captions, you should be able to get subtitles at the bottom. And just to familiarize everyone with the chat, I'd love, and I already see people are starting to introduce themselves in the chat. So if you could say your name, your agency, and then for the icebreaker today, maybe we could just do, what's the most beautiful place near where you live? So if you can continue to pop that in the chat, I will hand it over to Rachel now.
Hi, thanks so much, Nicole, for the introduction. My name is Rachel Nino. I'm a senior attorney with the health program with the Law Foundation of Silicon Valley, and I will be conducting today's training. And I'll let Becky introduce herself as well.
Hi, I'm Becky Moskowitz. I'm a supervising attorney with the Law Foundation of Silicon Valley, and my pronouns are she and her. Turning it back to Rachel.
Thanks. Before we get started, I just wanted to make one general comment about questions, which I know Nicole highlighted briefly when she was doing her introduction. We are going to have a space for questions partway through the presentation and then at the end of the presentation as well. The only comment I wanted to make in relation to questions is that if your question is really client specific or driven by a case that you're working on in particular, it's likely we won't be able to actually answer those questions. We can answer very general questions. But if you have a question related to a specific client or a specific client fact pattern, we would encourage those questions actually to be referred to our office, and we'll talk about how to do so at the end of the presentation. So to the extent that your questions are general, we should be able to answer them, and we will do so to the best of our ability. But any very fact-specific questions we will be unlikely to answer. And so with that, let's get started on navigating mainstream benefits, SSDI and SSI Part 2. Next slide. I will go over this slide briefly. We talked about this in the presentation yesterday for those of you who attended, but for those of you who may be new, I just wanted to give you a little bit of information about our agency. Becky and I both work with the Law Foundation of Silicon Valley. We are located in downtown San Jose, and our agency provides free legal services in 3 areas. There's the health department or the health group, which Becky and I are a part of. There's a housing unit, and then there's also a unit that works with children and youth. And because Becky and I are here representing health, I wanted to let you know what our practice area focuses on. Specifically, we provide legal services to individuals living in Santa Clara County who are living with mental health disabilities or who are living with HIV or AIDS. And we help those people or provide legal services to them in a variety of areas. So we do some mental health patients' rights work, which is representing patients who are in psychiatric facilities on involuntary holds they are entitled to, and we provide representation to them at hearings to determine if they can continue to be held for mental health treatment. And we also work with them to secure appropriate behavioral health care and make sure that they're getting their mental health treatment in a manner that's promotes dignity and autonomy and respect. So we do a lot of work around individuals' entitlements to kind of holistic and well-intentioned mental health work or services. And then our public benefits practice focuses on helping people obtain and maintain their benefit eligibility for programs such as Social Security, so that's the SSDI and SSI benefits that we really went into in depth yesterday, as well as helping them obtain and maintain eligibility for Medi-Cal, their healthcare, for general assistance benefits, for CalFresh, and for a host of other public benefits that may be available at the local or state or federal level. Next slide. Yesterday, I went through a training roadmap just to kind of talk about what the presentation would go over, and I'll do the same thing today. So yesterday, we talked a lot about initial eligibility, how to determine if somebody's eligible and how to strengthen a case for eligibility for SSDI and SSI. And we talked a lot about the application and appeal process. Today's presentation is really the second facet of obtaining and maintaining SSDI and SSI benefits. So we're really going to focus on post-eligibility issues. What happens when your client has SSDI or SSI? Issues can still come up. There's lots of stuff that happens even once an individual is on benefits and receiving benefits. So we'll talk a little bit about what happens with respect to the health insurance to which an individual is entitled once they're on either SSDI or SSI. What happens if an individual needs a representative payee because Social Security has determined that they're unable to manage their own benefits. How an individual's living arrangements can affect how much they receive in SSI benefits. What happens if a person's on either benefit program and they become incarcerated? And then there's always lots of questions about, well, can somebody work while they're getting SSDI and SSI, and how does that impact their receipt of benefits? So we'll talk about that for a little while, and then we'll also talk about another major issue we see, which is overpayments, which can happen on both SSDI and SSI accounts. Next slide. We stressed this yesterday, and I wanted to stress it again, especially for people who may be new to today's presentation. Social Security rules are complex, they're frustrating, they're confusing. Even as lawyers, we often have to look things up and do some research before we understand what our clients' rights are. So understandably, if you don't practice Social Security all the time, it may feel even more complex. So please don't feel like you need to memorize everything we're sharing with you here. It's on the slide deck, so you can reference it at any point in the future. And our goal in today's presentation is really just to give you the information so you can start to kind of issue spot Social Security issues, either related to pre-entitlement or post-entitlement issues. So that if a client comes to you for help, you might say, this sounds familiar. I think I've heard something about this before. Let me take a look at the slide, see if there's some helpful information, or maybe this is something we can refer to the Law Foundation because this sounds like a sticky issue that a client could use some help with in dealing with their SSI or SSDI benefits. So really pay attention to whether any of your clients gets a notice from Social Security that either you don't understand or the client doesn't understand, or there is an issue related to their payments, and know that we're here to help with those issues. It can be difficult to interact with Social Security. We have kind of some tips and tricks to try to get around that. So if you're having trouble communicating with Social Security, know that it's not just you, and again, that we're here to help. We can't fix the problem entirely, but we have workarounds. So please reach out to us if that comes up. Next slide. So hooray, your client was approved for benefits. Now what? The focus of today's presentation is post-eligibility issues. Next slide. So let's talk about insurance tied to the receipt of SSDI. And we're going to talk about insurance tied to the receipt of SSI as well in a minute. And we touched on this a little bit in yesterday's slides. I think it was just a bullet point or two about what happens when somebody becomes eligible for SSDI. When do they get Medicare? So unfortunately, Medicare does not start as soon as somebody's entitled to SSDI. There is a 24-month waiting period. So an individual who becomes eligible for SSDI then becomes eligible for Medicare 2 years after SSDI entitlement. And I think we talked a little yesterday, and I'll reiterate today, that sometimes it can take somebody 2 years to actually get onto SSDI, if not even a little longer, between the application and appeal process and potentially hearing before an ALJ. And when they do finally get onto Medicare, it's retroactive to when they applied, then that Medicare is going to kick in right away because that 24-month waiting period has already run its course. But for somebody who may apply for SSDI and be approved a couple months later because their initial application is approved or they're approved at appeal, they're still going to have a waiting period before that 24-month expires and the Medicare will kick in. Another facet of this that makes it a little more complex, but that I just wanted to highlight for you, is that somebody's entitlement to SSDI is not coterminous with the onset of their disability. So if somebody's disability starts January 1st, and that's their alleged date of onset of disability, their entitlement to SSDI actually doesn't begin till 5 months later. So 5 months from January 1st becomes January, February, March, April, May, June. Then you're looking at 5 months out plus another 24 months. So actually it's 2 years and 5 months from the onset of actual disability before the Medicare kicks in. So again, those dates can be kind of hard to, no need to memorize those dates. And kind of sometimes you have to look at case by case to see when an individual's onset of disability began, when their entitlement to SSDI began, to figure out when the Medicare will start. But just so you know, really the takeaway is that Medicare doesn't start automatically when the SSDI entitlement starts. And then if and when the individual qualifies for Medicare, which is 2 years after SSDI entitlement, Medicare coverage may come with a cost for the claimant or the beneficiary. So first there's Part A, which is hospital coverage. So an individual becomes eligible for Medicare Part A 24 months after SSDI entitlement. If the individual is fully insured, meaning they've worked a full 40 quarters, and so they're eligible for Medicare Part A at the full insured rate, then their Medicare Part A is going to be free and will come at no cost to them. If an individual is on SSDI, but they have fewer than 40 credits or 40 quarters of work credit, there is going to be a slight premium. So for individuals with 30 to 39 work quarters, the premium currently in this year, 2022, is $274 a month. And for individuals with fewer than 30 quarters of work credit, their Part A premium in 2022 is actually going to be $499 a month. And Social Security will be the one to determine how many quarters, work quarters an individual has accrued. Part B, which is outpatient coverage, Individuals in SSDI are entitled to Part B after 24 months as well. And they typically have to pay, regardless of how many work quarters they have, a premium of $170.10 a month. And that amount is taken out of, it typically is taken right out of their SSDI benefits, so they don't have to make a separate payment on their own. They'll see that they're entitled to X amount of SSDI less the $170.10 for Medicare Part B coverage. And that's just automatically deducted by the Social Security office, who works with the Center for Medicare Services, CMS, to make sure that that premium is paid and the coverage is provided. And then an individual also is entitled to Part D, or prescription drug coverage, 24 months after SSDI entitlement. And there is typically a premium associated for that, and the amount of the premium really depends on the plan that the individual purchases. So the prescription drug coverage, there's different plans, and the individual can pick which plan they want to go with in order to have coverage for their prescription drug needs. And just so you know, for Part A, B, and D, deductibles may apply. So right now, I've just kind of given you the scope of the coverage and what the premiums are, but clients should also know they may have a deductible associated with their Part A, Part B, or Part D Medicare coverage. Next slide. We are not insurance specialists, so sometimes people have a lot of questions about, well, which Medicare plan is best for me, especially when they're looking at potentially Part D coverage. So individuals who are interested in comparing the Medicare plans available to them, we often refer them to an agency locally known as SourceWise. SourceWise is based in Santa Clara County. They also have a Morgan Hill office, and they run what's known as HICAP, or the Health Insurance Counseling and Advocacy Program. And so this is a great referral if you have clients who have become eligible for Medicare and aren't sure which plan to elect. They want to compare deductibles, potential co-pays, what coverage exists under each plan. We will refer those clients to SourceWise's HICAP program. They can go online to make an appointment, or they can call either of the offices, depending on what's most convenient for them, and make an appointment with a HICAP specialist who will meet with them and talk to them about the different plans and the pros and cons and which plan works best for that individual. One thing I wanted to highlight is that individuals who are low income and on Medicare may qualify for a state-sponsored Medicare savings program. So the state of California runs a program that will help pay part or all of Part A or Part B premiums and deductibles. So some individuals who are above the income threshold will pay the Part B $170.10, may pay Part A if there is a premium with that. But individuals who are below a certain income threshold can get assistance from the state of California to cover those premiums and deductibles associated with Part A and Part B Medicare coverage. And to apply for the state-sponsored Medicare savings program, we always encourage individuals to contact the local social services agency to do so. And the social services agency can get the application started and notify the person if they've been approved for the state-sponsored assistance to help pay for those Medicare programs on their behalf. Next slide. Okay, fortunately, insurance tied to SSI benefits is a little bit easier and less complicated than insurance that's tied to SSDI benefits. So an individual who is eligible for SSI is automatically eligible for and automatically enrolled in SSI linked Medi-Cal. From the moment they become eligible for SSI, there's no waiting period as there is with the SSDI and Medicare entitlement. The individuals who become eligible for SSI do not need to apply for Medi-Cal on their own. The Social Security Administration will notify social services, and the Medi-Cal application will get started and approved. And Medi-Cal coverage will begin the same month that the SSI benefits begin. So much simpler, shorter slide on SSI linked to Medi-Cal. Suffice it to know that if your client does get approved for SSI, they will also be approved for SSI linked to Medi-Cal at no share of cost. The next slide. So now that we've discussed the first of our topics, which is health insurance tied to the SSDI and SSI benefits, hopefully that's provided some clarification on the health insurance to which your clients may be entitled once they receive their benefits. I want to talk about another issue that comes up from time to time with some of the clients that we work with, which is the idea that Social Security feels that some individuals who have been awarded either SSDI and or SSI benefits are not able to manage their benefits themselves. And in those instances, Social Security will decide that the individual needs a representative payee. That is a person who can receive and manage the benefits on behalf of the entitled party. So as this first line indicates, in some instances, Social Security decides that a benefit recipient is incapable, either for physical health reasons or mental health reasons or cognitive health reasons, that the individual cannot manage their benefits. And so if they make that determination, a representative payee must be appointed to manage that individual's benefits. What we recommend to claimants or beneficiaries who've been awarded benefits and who also are required to have a representative payee is that they try to find a friend or a family member to serve as that representative payee if they have someone that is willing to do that for them. Oftentimes friends and families are willing to do it at no cost, so the person does not lose any of their benefits. They just have somebody else helping them manage it, helping them pay their rent, doling out a certain amount of money for them to buy personal needs items or food, and they'll do it at no cost. If an individual does not have a friend or a family member who is willing or able to serve as a representative payee, then the Social Security Administration will look for a qualified organization to act as the representative payee on that claimant or beneficiary's behalf. But the qualified organization is going to take a monthly fee for operating in that capacity. And unfortunately, in San Jose, we only have one rep payee organization. They're known as a Benefits Management Corporation, or sometimes we refer to them as BMC. BMC typically charges the beneficiaries that they're serving approximately $40 a month to manage the benefits, and that $40 comes directly out of their SSDI or SSI payment. And once the benefit or the money goes into BMC, they withdraw that $40 fee, and then they help the individual they're serving or working for manage their payments, pay rent, take out personal needs money, so on and so forth. So again, big takeaway is if somebody can find a friend or family member to do it, that's the most optimal circumstance or situation. But if there is nobody, then we do have BMC to serve in that capacity for clients in the area who are required to have a representative payee. Next slide. So let's talk a little bit more about what that representative payee does on behalf of the beneficiary, the person receiving benefits. Again, whether it's a family or a friend or BMC, the representative payee's duties include kind of a whole host of things. They receive the benefits on behalf of the entitled individual. They pay for that individual's current needs, again, things like food, personal hygiene items, maybe gas for a car, bus passes, and so on and so forth. They may allow or assist the person to set aside some money for future needs. Again, understanding that with SSI, you can't save up too much, otherwise you could jeopardize your SSI eligibility. But you can save aside some money, especially on SSDI, where there's no concern about saving money and becoming ineligible for being over income. But they can help save for future needs. They can provide spending money. They do need to keep records of the money that comes in and the money that's spent and how it's spent. They are required to report the use of their funds to Social Security, and Social Security may ask for this at any time. And then if there is an overpayment that occurs on the person's SSDI or SSI account, the representative payee is responsible for returning any overpayment to Social Security. And so lots of times you'll see representative payees working back and forth with Social Security to negotiate a repayment rate, or hopefully if they think maybe the individual is entitled to a waiver, or the overpayment was inaccurate, they should also be doing things like pursuing a waiver of the overpayment or requesting an appeal of the overpayment. And we'll talk more about those responses to overpayments towards the end of today's presentation. But for now, I wanted to highlight that a representative payee does have the responsibility as well, not just to return the overpayment, but really to investigate whether the overpayment is accurate and whether there's a way to challenge the overpayment on behalf of the beneficiary. Okay, next slide. So what happens if you have somebody who is receiving benefits and has a representative payee, but they feel like they can and should be able to manage their own benefits? What can that individual do? There are options. So the beneficiary with a representative payee who wants to become their own rep payee or wants to receive and manage their benefits themselves does have the option to file a request with Social Security to become their own rep payee. And then what we advise clients to do in this situation is to go to the local Social Security office in person to start the application process. That's difficult right now since the offices are not open. So an individual could call the local Social Security office and say, I'd like to become my own representative payee, and start that application over the phone. And then the next step is for Social Security to process that application, and then Social Security needs to send a request to that person's doctor. So the individual, when they start the application, will need to have information about the doctor's name, the doctor's address, the doctor's phone number, who can certify that the individual is qualified to manage their own benefits, so that Social Security can send the proper forms to the doctor. The claimant or the beneficiary cannot take the forms to the doctor his or herself and bring them back. Social Security wants the communication between its office and the doctor's office to be direct without the client being involved in that. So Social Security will send the form to the doctor and ask the doctor if that individual is mentally and physically capable of handling their benefits. And then the doctor needs to mail or fax that form directly back to Social Security. And then once that information is in from the doctor, especially if the doctor's note is supportive of the individual becoming their own rep payee, Social Security should approve it. If the doctor's note is not supportive, then the Social Security may deny that request. So this is just kind of a real overview of what happens when somebody wants to become their own rep payee, but we do have some great information sheets within our office that are up to date, and that can provide detailed step-by-step instructions. So if you have a client who's dealing with this issue, either feel free to refer them to us or email our intake line, and you can ask, can I get that info sheet on becoming your own rep payee? And we'd be happy to provide that to you. Next slide. Okay, so we talked yesterday a little bit about SSI rates and how they may vary depending on a person's specific or individual circumstances. So let's talk a little bit more in depth today about SSI living arrangements and how it impacts a person's receipt of SSI benefits. So how much an SSI a person receives each month is based on their living arrangements. This is different from SSDI, where it does not matter where a person lives. Regardless of where somebody's living or what access to cooking facilities they have, for SSDI, the amount the person receives will always be the same, with the exception of whether of there being an overpayment or some other reduction in SSDI benefits. But living arrangements never impact an individual's entitlement to SSDI. On the other hand, a person's living arrangements do impact a person's receipt of SSI. So for example, if a person is living independently, they do not rely on anyone else for help with paying their own monthly expenses, and they have their own cooking facilities, they're generally going to receive the full SSI benefit rate, which the full SSI benefit of $1,040.21 for 2022. That amount increases slightly each year, but for 2022, the rate for an individual living independently is $1,040.21. So independent living really means that you're either living alone or you're living with a spouse or children, and nobody outside of the home is paying for that, your food or shelter, or you're living with other people and you're paying your fair share of the food and shelter expenses. That's what independent living status means. If a person is living independently, but they do not have access to cooking facilities, so for example, they may be unhoused, or they may be living in a shelter and they're not getting 3 meals a day while living at the shelter, they're going to be eligible for what's known as the homeless rate, or the restaurant and meals allowance rate. And that's a slightly larger amount that Social Security provides in SSI benefits in order to account for the person needing to purchase restaurant meals. So instead of $1,040.21, a person who's living independently but without access to housing or without access to cooking facilities is going to get $1,147.20. And as I mentioned, if a person is staying in a shelter, they may still qualify for that unhoused rate if they're not getting 3 meals provided to them a day. If they're living in a shelter and they do have food provided to them, then they're not going to get that increased rate. They're actually going to stay at the 1,000. They may actually be getting a slight reduction because they're getting in-kind support and maintenance from a third party. So again, it's really important because of these fine-tuned rules about how much a person is entitled to based on their living arrangements, that clients notify Social Security every time that they move so that Social Security can update their living arrangements and correctly calculate the amount of SSI benefits to which the person is entitled. Next slide. Okay, so I started to mention this on the slide before, but if you're living in a homeless shelter or you're living with another individual and you're not paying your fair share of food or shelter costs, SSA will actually reduce the amount of SSI a client receives. So SSI will reduce the amount if an individual is living in another person's home and they're paying less than their fair share of food and shelter costs. So let's say the SSI recipient is living in an apartment with a friend and the rent is $1,000. And that person, the individual receiving SSI can only contribute $300 to the rent. In that instance, they're paying less than their fair share of the shelter cost. And so their SSI will be reduced as a result. SSA will also reduce the amount of SSI a client receives if they're living in their own home or apartment, but somebody else is helping pay for their food, rent, or utilities. So not just the shelter cost, but utilities count, right? Gas, water, electricity, so the PG&E bill, the water bill. And these rules are related to SSA's rule about in-kind support and maintenance. So it's the idea that if somebody's receiving support or maintenance from a third party, whether it's actual cash or actually just support and maintenance in the sense of having your rent or utilities or food paid for or contributed to by a third party, then that you're not going to be entitled to as much SSI as you would otherwise. And then if an individual is hospitalized or placed in a nursing facility for 30 days or more, then the amount of SSI that the individual is entitled to will also be reduced. So in addition to always notifying Social Security about a change in living arrangements, it's very important to notify Social Security if an individual on SSI has been hospitalized for 30 days or more, because that will impact the SSI they're entitled to for that month in which they're hospitalized. Next slide. Okay, so let's talk a little bit more about the in-kind support and maintenance rule, because this is, it can be a complicated rule, and I think it just bears a little bit more discussion. So again, in-kind support and maintenance, which we often refer to as ISM, is food or shelter costs that someone else pays for on behalf of someone who's receiving SSI benefits. So things that do count, including if somebody on SSI receives a federal housing subsidy, that counts as in-kind support and maintenance. If they're receiving federal housing subsidies, food stamps, and home energy assistance payments do not count. But utility payments, shelter costs include, let me step back on the slide. So federal housing subsidies like food stamps, home energy assistance, and payments do not count as in-kind support and maintenance. Shelter costs do include utility payments, but it does not include things like cell phones or cable. So if somebody's paying your cell phone bill or your cable bill, that's not considered in-kind support and maintenance. However, if somebody's helping pay rent, mortgage, food, or utilities, Social Security will reduce the amount of the SSI that the person's entitled to. And in 2022, the reduction amounts to somebody, and rather than receiving the $1,040.21, the monthly payment of people on SSI who also are receiving in-kind support and maintenance will be reduced to $764.25. So it's about a third of the SSI benefits that are taken off when somebody's receiving in-kind support and maintenance. Next slide. So let's go through a couple of hypotheticals, and I think maybe we can have the chat so people can respond via the chat, or if somebody wants to unmute themselves and answer, then they can feel free to do so. But we have just a couple of hypotheticals to illustrate this idea of in-kind support and maintenance and how it impacts an individual's eligibility for SSI. So in this instance, we have an individual named Joe who's living alone in an apartment. Joe's brother, however, pays Joe's full monthly rent of $1,200. Will Joe's SSI be reduced because of in-kind support and maintenance? Feel free to share your thoughts in the chat. Okay, so I'm seeing a lot of yes, 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 benefits will be reduced. And yeah, that is correct. So Joe's SSI will be reduced because we see in this hypothetical that Joe is not paying for his shelter costs. Joe is having a third party, his brother, pay for his shelter cost. Now, as a result, Social Security treats that payment of shelter as in-kind support and maintenance. And as a result, Joe's SSI will be reduced, likely to the $764.25 rate. Next slide. So in this hypothetical, we have Maria, who's living alone in an apartment with a Section 8 voucher that requires her to pay 35% of her income towards rent. She pays her full rent portion on her own, so she pays whatever is required because of the Section 8 subsidy, and she uses her SSI money to do so. Maria's parents pay her cable TV bill. Will her SSI be reduced because of ISM? Yeah, okay. And I'm seeing a lot of no's, and this goes back to the slide where I had to stop and kind of reiterate my thoughts because I got a little twisted up, but the answer is correct, right? So I tried to reiterate when I messed up a little bit earlier, but the idea is that Section 8 vouchers don't count as in-kind support and maintenance, so that's excluded. And also, Maria, so that does not result in a reduction of her SSI benefits. The fact that Maria is getting a Section 8 voucher will not count against her. In addition to which, her parents are paying a bill for her, but it's her cable TV bill, and those are excluded from the in-kind support and maintenance rule as well. So because of the Section 8 voucher and the cable bill, those will not impact her SSI benefits, and they will not be reduced because of in-kind support and maintenance. But let's take the facts and change them up a little bit. What if Maria's parents also pay her PG&E bill or buy her groceries? Does that change your answer? In that instance, will Maria's SSI be reduced because of in-kind support and maintenance? Great. Yeah, I see a lot of people saying yes in the chat box. Yeah, and that's correct. And that's because, again, per the slide a couple of slides ago, PG&E bill is a utility bill. Groceries is food. Both food, utility bills, and shelter all count as in-kind support and maintenance. So if somebody is receiving payment for purchasing of utility bills, PG&E bills, food, then an individual's SSI is going to be reduced as a result of receiving in-kind support and maintenance from a third party. Okay, let's go to the next slide for one more hypothetical. So Brandon lives with his brother and two sisters in a home that his brother owns. The mortgage payment is $3,000 a month on the home. Utilities are $300 a month. The household food for the individuals living there is $600. So the total household expenses for mortgage, utilities, and food is $3,900 for 4 people. So what is Brandon's fair share of the household expenses? Pull out your calculators and do a quick math. Okay, so I see a lot of people coming up with 975, and that's correct. So to figure out what Brandon's fair share of the household expenses is, you just take the total costs, the total household expenses of $3,900, and divide it by 4 to determine how much each individual is responsible for in order to contribute their fair share. And the answer is 975. So if Brandon is paying 975, then he is contributing his fair share of the household expenses. He's helping towards the mortgage, he's helping towards the utility bills, and he's helping towards the food. If Brandon pays 975 a month, will his SSI be reduced because he's receiving ISM? Right. So I'm looking at the chat and seeing a lot of people are putting no, and that's correct. If an individual pays their fair share of the household expenses with their SSI benefits, then they will not have a reduction in SSI because of in-kind support and maintenance. And just to kind of elaborate on the point a little bit, if the household expenses were more than that, 5,000, for example. Oh, sorry, I'm getting an echo. Maybe we can mute. Thank you. Thanks, Nicole. If the household expenses were more, there were 5,000, and the amount that Brandon was responsible for was more than his SSI payments allowed him to contribute towards, and he couldn't pay his fair share, then in that instance, he would have a reduction to his SSI benefits if he could not pay the full fair share of the $5,000 because his SSI benefits were insufficient to cover that. In that instance, he would have a reduction in SSI because he was getting in-kind support and maintenance from his brothers and sisters because he wasn't paying his fair share. Okay, next slide. So we're going to talk a little bit about what happens if an individual is receiving either SSDI or SSI payments and becomes incarcerated for a period of time. It's important to remember that both SSDI and SSI payments generally are not payable for the months when an individual is incarcerated. If the client's benefits can be reinstated starting with the month following the months of the client's release. So if the client is receiving SSDI benefits, the client's benefits will be suspended if they are convicted of a criminal offense and sent to jail or prison for more than 30 continuous days. It's important to remember that pre-conviction incarceration, meaning if you're incarcerated prior to actually being convicted, does not count toward that 30-day period. And then also incarcerations for probation or parole violations do count from the date of the order where the person's probation or parole are revoked. But important for SSDI, if it's pre-conviction incarceration, that does not count to the termination of towards 30 days, at which point the SSDI needs to be terminated. It's only if the person has actually been convicted of a criminal offense and has been imprisoned or put in jail for 30 days or more that their SSDI benefits should stop. And then again, once they're released, their benefits can be reinstated the month following their release. For SSI benefits, next slide, it's slightly different. If a client's SSI benefit is on SSI benefits, if they're incarcerated, their payments are suspended if they're incarcerated for a full calendar month. But unlike with SSDI benefits, whether or not a client is convicted does not matter. As soon as they're incarcerated, even if there's not a conviction yet, and it's been 30 days or a full calendar month, the payments for SSI will be suspended. And like SSDI, if a person is released, the SSI payments can be reinstated again the month after the individual is released from incarceration, unless the person's been incarcerated for 12 months or longer, in which case an individual will need to apply for SSI again. So after SSI benefits have been suspended for 12 months, they will be terminated. And for a person to get back on SSI, they need to start the application process over again and ask for SSI benefits and go through the process of application that we talked about in depth yesterday. So it's very important for clients to tell Social Security about when they're released and provide documentation from the jail or the prison showing the dates of their incarcerations, the date they were incarcerated and the date they were released, so they can prove to Social Security when they were released and when they're re-entitled to SSI benefits. Next slide. All right, so let's break quickly for a poll question. I'm going to throw poll question number 1. So this goes back to what we talked about towards the very beginning of today's presentation. So true or false, a person is eligible for Medicare as soon as they are entitled to SSDI. I'll just give people a few more seconds to answer because I still see some answers coming in. Okay, so it looks like most people have answered, and this one was, we had about 66% of people saying false and 34% saying true. So let's see, in poll share results. I don't know. I think hopefully you guys can see the results being shared. So I just wanted to go back and mention that as we talked about in the beginning of the presentation, unfortunately, when a person is entitled to SSDI, they're not automatically entitled to Medicare. There is that 24-month waiting period from the date of their SSDI entitlement. So it's not an automatic Medicare entitlement. Unlike SSI, where as soon as a person is entitled to SSI, they're automatically eligible for and enrolled in Medi-Cal. With Medicare and SSDI, there is a 24-month waiting period. Okay, I'll stop sharing. And next slide. We have another poll question. So the second poll question I'm going to launch right now. So a person is eligible for Medi-Cal as soon as they are eligible for SSI benefits. Okay, looks like we have quite a few answers in, so I'll wait one more second. Okay, I'll end poll and just share the results. So this one, they're closer to 90% said that's true. And yes, that's true. So as I mentioned at the end of poll question 1, Medi-Cal entitlement is automatic as soon as a person is eligible for SSI. And again, the person does not need to do anything to get their Medi-Cal started. They're automatically enrolled in, and Medi-Cal is started automatically once their SSI eligibility starts. Okay, stop sharing. All right, so next slide, we're going to break for a few minutes and take some questions. And Becky, if there's questions in the chat of particular interest, I can respond to that. Or if there's people who want to unmute themselves momentarily and ask a question, that's great.
Hey there. So I noted a few down. The first question was, I guess folks have observed that sometimes when they're working with an individual who's experiencing homelessness and they get into a COC funded housing program, they see a reduction in benefits. Can you explain why that's happening?
Mm-hmm. So likely if somebody is getting into a shelter through the Continuum of Care program and their SSI was higher and is now being reduced, it's likely that the individual prior to being placed in the shelter was getting the unhoused or the unhoused rate, which is really also really known by Social Security as the restaurant and meals allowance. So it's basically allowing for that individual who was unhoused to have some extra SSI because they don't have access to cooking facilities and therefore they need to purchase food out, and that can be more expensive. They're buying their food at restaurants or buying pre-made food a lot more, and that's more expensive than purchasing groceries and cooking on your own through the use of your own cooking facilities. But if that person then ends up becoming housed through a shelter program and they're getting their meals covered for them through the shelter, that means that the person is not entitled to that restaurant and meal allowance and is likely going to see a result in their SSI benefits as a result. It's going to see a resulting SSI reduction because of the fact that they're no longer entitled to the restaurant and meal allowance.
Awesome. Next question is, for folks who receive both SSI and SSDI so that they're eligible for both Medi-Cal and Medicare, how do they ensure that they're getting their Medicare Part B coverage paid for, which is their outpatient visits? And then how can they get assistance with Medicare Part D, which is the drug benefit coverage?
So if they're on Medicare and Medi-Cal, how do they make sure that the Medi-Cal is covering the Medicare portions of the Part B premium? Is that correct? Okay.
And then the additional question is, how do they get assistance with Medicare Part D, the drug benefit premiums?
So I think, you know, if a person's on both of those, the state social services agency who is helping the person, you know, get enrolled in the Medi-Cal coverage should be aware of the fact that they're also on Medicare and will help the individual apply for subsidies that are run by the state of California to cover the costs of Medicare Part B premiums and deductibles and copays, as well as Medicare Part D premiums, copays, and deductibles. If an individual is not having that happen, if they haven't been qualified for a subsidy, I think they need to speak with their social services eligibility worker or their caseworker to ensure that they're being vetted for and enrolled in the subsidy programs that help pay those premiums and deductibles on their behalf. And if somebody's on Medicare and Medi-Cal, they should be in Santa Clara County enrolled in a managed care plan. So it's one plan that's basically managing both their Medicare and Medi-Cal benefits, so that there's some kind of continuity of coverage, and also insurance that where Medicare is not covering something, Medi-Cal is picking it up as the secondary provider.
And I think you just addressed the question in the chat. Thanks,
Okay.
Rachel. And just confirming what Rachel said, that Medi-Cal is the secondary coverage to Medicare if the person receives both. So it fills in the gaps of what Medicare doesn't pay. What does somebody do if their representative payee they think is committing fraud or misusing their benefits?
Oh, well, that's a great question. And Becky, you can share some thoughts too, but I think definitely, I think alerting Social Security to the concern that there's some mismanagement of benefits. I think Social Security needs to know and be aware of the fact that, for example, if there's only one organizational rep payee here, or if it's a family member or a friend, then Social Security should be notified. I also think that if there's that concern, that the individual should right away try to find a different person to serve as a rep payee on their behalf. I don't know. Do you have other thoughts too? I think sometimes maybe involving adult protective services if the individual is aged or elderly, but I don't know if you have other thoughts, Becky.
Adult protective services could potentially be brought in also if the person has a disability, although our office as a general rule tries not to get law enforcement involved on these situations. But the other thing I think that's relevant to flag here is that Social Security has kind of a lesser known rule in California that says that they're not allowed to stop someone's benefits simply because they need to get a representative payee set up. And so sometimes that takes a little bit of advocacy to say like, hey, this current representative payee is not appropriate, but we also want to make sure that you continue to pay the individual directly until they're able to come up with a new plan, whether that be getting the doctor to fill out the form so that they can be their own payee or getting a new representative payee set up. Next question is kind of more like tips and tricks for how to get around the in-kind support and maintenance reductions, particularly if somebody has been getting financial help from their family while they've been awaiting getting approved for their SSI benefits. How do they then kind of bridge that gap to show that they're now paying for things independently and should be getting their full SSI amount? And if you have any other tips and tricks for getting around in-kind support and maintenance, that might be also helpful.
I mean, I think that if somebody's waiting for SSI and they're getting receipt of benefits or assistance from family members, for one thing, I think it's helpful to know if the individual is getting that assistance from a friend or a family member as a gift or as a loan. If they're getting it as a loan and they are required to pay it back to the person who's lent them that money to help pay for shelter or food or utilities, it's helpful to have something in writing that says, you know, my brother or my friend assisted me and provided me with $1,000 a month for 6 months while I waited for my SSI application to be approved. I'm obligated to pay this person back, in which case you could submit proof of that to Social Security. They should be entitled to their full SSI rate for all of those months. If they're entitled to retroactive or back pay, they're going to be entitled to the full SSI for all of those months, presuming that that loan is valid and that they do intend to pay that individual back for the money they received as a loan to help them get by until their SSI actually started. I think if it's actually a gift and there's no intent or requirement for the individual to pay the money back, then you know, for the time period in which the individual was waiting to get on SSI, then any retroactive payments are going to be impacted. There is going to be a downsizing to the amount of SSI the individual is entitled to as a result of that gift money, that assistance paying for costs. I think going forward, if an individual is receiving SSI proactively or going forward and they're no longer getting that money, or assistance from friends or family because they bridged the gap, they're now on SSI, they can report that to Social Security and say, I'm no longer getting this assistance from my father, my brother, or my friend because now I have SSI and I'm paying all my fair share of my expenses myself. I'm paying all my expenses, or I'm paying my fair share of expenses if I'm living with somebody else, and so therefore I'm entitled to the full SSI. And Social Security does have a statement form that claimants can fill out to explain, here's how I'm paying for my expenses. I'm no longer receiving any gifts or assistance from third parties, or I did receive it for these months, but I have to pay it back. So there's different ways to explain that to Social Security, but I don't know that there's really tips and tricks around or ways to get around ISM. If a person is receiving third-party assistance in the form of food or shelter or utilities, then it is going to count against them and reduce their SSI benefits.
And I'll just add on to that. If somebody is continuing to get assistance from their family and is having their SSI reduced due to in-kind support and maintenance, there are some creative things that folks can do to try to get around that. For instance, you know, if they are sharing housing and they have a room in a 3-bedroom house with 2 other people and they can't afford to pay a full third of the rent, well, is their room substantially smaller than the others and therefore the rent they should be paying for that room is actually less? Can you find other rental units on like Craigslist or whatever people are, you know, posting on these days that have lower valued rents to show that the value of what they're renting is actually less? Are they not using the parking space? Are they not using the kitchen? You know, are there parts of their housing situation they're not getting the full benefit of, and therefore the cost of their housing should really be considered lower than what Social Security is valuing it at? Other suggestions are if family want to provide support, like Rachel mentioned, there's things like paying the person's cable or phone bills or other things, or helping pay their transportation expenses or other things that will not count towards in-kind support and maintenance, so that they can use their SSI solely for their rent, food, and utilities, and not have their SSI reduced.
Yeah, good tips. Thank you. I think that maybe you should move. It's a 12 o'clock. I know we have till 12:30, and I want to make sure we get to some of the working while receiving SSI material. So let's move to that, and we'll save some time for questions at the end as well. So there's always lots of questions about what happens to an individual if they're working while they're receiving either of the benefits. We talked about yesterday a little more in depth when we were talking about how to prove eligibility for SSDI and SSI, and eligibility is based at the very first level on determining that the individual is unable to engage in what's known as substantial gainful activity, or SGA, which means that a person is unable to work and earn more than $1,350 per month through employment, in which case Social Security says you met the first step of the disability analysis, the requirements for disability. But even if an individual can't work and earn more than $1,350 a month, so the individual may still be able to do some limited work. And Social Security does provide some limited protections to try to encourage people to work. And so each of the programs, SSDI and SSI, has a different policy around the person's ability to work while receiving benefits. So we'll talk about each in turn. Next slide. So the SSI return to work rules, which are probably the more simple of the two, basically says that if an individual is working and earning some money, their payments, their SSI payments, will be reduced by the individual's other countable income. So countable income means whatever their gross monthly earnings is minus an $85 exemption. So let's say, well, we'll walk through an example in a second, and then that number is divided by 2. So let's say a client is receiving $1,040.21 a month in SSI benefits, which is the standard rate for an individual with independent living status. And then that person also makes about $500 per month at work. And I often use kind of gig economy jobs is a good example, right? Maybe the person does some DoorDash work, so they don't work every day, or they only work when they are feeling really up to it because their disability may prevent them from working 5 days a week. And they're doing some DoorDash work and they earn $500 from DoorDash that month because of their work. How do we determine how that $500 impacts the amount of SSI they're entitled to. Well, as I mentioned above, you take their gross monthly earnings of $500 and subtract $85, which is that exemption that Social Security allows for. So now they've really earned $415 in Social Security's books. Then you take that $415 and you divide it in half. So that's $207.50. So all of that is to say that the full $500 doesn't count against the individual and their SSI benefits. It's not dollar for dollar. It's $207.50 of the $500 is going to be attributed to that person for working that month and impact their SSI benefits. So after you've calculated that $207.50 of their basically the countable income for that individual for the month, the client's SSI payments will be lowered by that amount. So again, if a client's receiving $1,040.21, and then you subtract the countable income of $207.50, which we arrived at through the step 1 and step 2 equation, then the person will be entitled to $832.71 in SSI benefits, because they've taken the SSI and they've subtracted out their countable income from work. But SSA is actually going to round that number down, so the person's likely to get $832 for the month as a result of their $500 in gross earnings through work. And because SSI checks are sent 2 months after the client earns the SSI, so January's payment is really not sent until March. March's payment is not sent until May. The person's SSI check will be reduced 2 months later. So if a client earns $500 in January of 2022, which results in $207.50 of countable income, which reduces their SSI payment accordingly, that $832, that reduced SSI benefit, will show up in their SSI benefits 2 months later. And we always tell clients, report your wages, report your earnings to Social Security. And we're going to talk about that in a moment. So next slide. So SSI wage reporting, very important that if a client is working and receiving SSI, they must report their gross wages for the prior month by the 10th day of the following month. So if you have a client working in March of 2022, they earn $500, $200, $100, and whatever it may be, they need to report that by the 10th day of the following month. So they would need to report that by April 10th of 2022. And that's true for every month in which a client earns wages through working. And then Social Security will adjust their upcoming payments accordingly. And again, the impact will be seen 2 months down the road, because SSI payments are earned and paid out 2 months after they've been earned. If an individual does not report their wages on time by the 10th of the month, it can result in an underpayment of benefits 2 months later, or maybe even an overpayment of SSI payments 2 months later. An underpayment would be unfortunate, because then the client has to wait some time before Social Security realizes they were underpaid and gives them the correct amount. If they're overpaid, that can be unfortunate as well, because then they'll receive a notice of overpayment and they'll have to pay that money back to Social Security. When the office is open again, hopefully in April of 2022, clients will be able to take their pay stubs in person to the Social Security office to turn them in and say, here are my pay stubs for the prior month. We've had mixed feedback on the smartphone application for SSI wage reporting. It works for some people, it doesn't work for everybody, but Social Security does have a mobile wage reporting app that people can download on their smartphones and use to upload pay stubs and notify Social Security of how much their wages were for the previous month. And just as important, if somebody stops working, they should notify Social Security as well, because that will obviously have an impact on their SSI benefits too. So key takeaway, wage reporting is important, and report your wages by the 10th day of the following month in which the wages were earned. Next slide. So let's do a quick hypothetical, talking about returning to work and an individual's on SSI benefits. Tony receives $1,040.21 a month from SSI benefits, and he wants to try working. So he gets a job as a peer mentor at a local nonprofit agency. So in 2022, this year, he gets gross wages per month of January $800, February $950, March $1,000, then $1,300, $1,350, $850, $900, $1,100, and another $1,100. So we've got a couple of months here. So in which months is Tony entitled to an SSI payment? So if people want to put it in the chat, or we can just talk through it. Yeah, somebody put January, February, March, June, July. And I think rather than waiting for everybody to respond in the chat, we can just talk about it. It's important to know, as long as his income from sources other than SSI does not exceed the SSI amount of $1,040.21, he should be entitled to an SSI payment. That SSI payment may be reduced as a result of his countable earnings in any given month. But if he's not making more in wages than he's entitled to an SSI payment, he should be entitled to SSI benefits. Will Tony's SSI be automatically terminated if he works over the substantial gainful activity amount? Yeah, and I'm seeing some people put no in the chat. So no, Tony's SSI won't be automatically terminated if he works over SGA. If he works too much, if he earns too much in income from another source, then he may not be entitled to benefits for that month. And as we mentioned, the month, it actually won't get paid out until 2 months later. So the SSI benefits are paid out 2 months after they earned. So 2 months later, he may not receive an SSI check because he's made too much in a given month in countable income, but it won't automatically terminate his benefits. So what might happen if Tony forgets to report all of his wages and doesn't remember to do so until sometime later in the future? What are some potential repercussions of that? So I just wanted to mention what we talked about before, that if he doesn't report his wages on time, really two potential things could happen. If his wages didn't have an impact on his SSI, then there won't be a concern. But if he doesn't report and his wages were lower than Social Security thought they were, he may be entitled to an underpayment. Or if his wages were more than Social Security was aware of, he may actually be required to pay back, or he may have an overpayment to which he owes Social Security for. So it could result in either an underpayment or an overpayment, depending on what his wages were for any of those given months. Okay, next slide. So the SSDI work rules, which we've saved for a second, are more complicated than SSI, and there are several steps. I'll read through them quickly, and then we'll get to each of these slides, just being cognizant of time. So there's the trial work period, which we call the TWP, the extended period of eligibility, which we often refer to as the EPE. There's the expedited reinstatement process, and then if somebody's reinstated through the expedited reinstatement, their initial reinstatement period kicks back in, and there would be a new trial work period, and it could go on and on and on, depending on a client's situation. So let's talk about that in more depth. Let's talk about the trial work period first. Next slide. So the trial work period is Social Security's efforts to allow clients who are receiving SSDI benefits to test their ability to work for at least 9 months. And during that 9-month trial work period, a client can receive their full SSDI benefits, regardless of how high their earnings are, as long as they report their work income and continue to have the disabling impairment that made them eligible for SSDI in the first place. So there's a trial work period of 9 months where they can work and get SSDI regardless of how much they're earning. Next slide. When does the trial work period start? So the trial work period starts the month a client earns over a certain amount in gross income. In 2022, that amount is $970. So any month in which a client earns more than that amount, the trial work period is going to start. And again, the client can still get SSDI in the first month and the second month and all the way through the 9 months of their trial work period, regardless of how much they're earning. As soon as they earn $970 or more, the trial work period begins, and that's the first month of the trial work period. Next slide. Okay, so how long does the trial work period last? We talked about the trial work period being 9 months, but how do we count those 9 months? So the trial work period continues until a client accumulates 9 trial work period months within a 60-month or a 5-year period. So if there's the first trial work period month, the client earns more than the $970, that's month 1 of the trial work period. And then for the next 5 years, or the next 59 months, really, Social Security will pay attention to the client's earnings. And if the client accumulates 9 trial work period months within that 5-year period, they've used up their trial work period. So it's important to note that the trial work period months do not have to be consecutive. There just has to be an aggregate of 9 trial work period months within a 60-month or 5-year period. And that's how long the trial work period lasts. And again, those months are all months in which the client can earn $970 or more and still get their full SSDI benefits. They're using up their trial work period. And Medicare eligibility is not affected during the trial work period. The person can still get their Medicare as well. But we did talk about how certain low-income individuals may be entitled to subsidies to cover their Medicare premiums and deductibles. But if a client is working as part of their trial work period and their income goes up, they may actually lose eligibility for those subsidies, even though they're not losing their Medicare coverage. Next slide. So let's talk about return to work trial work period rules in the gist of SSDI benefits. So Gina's work earnings in 2022 are as follows: January $985, and then $200, then $1,500, then $900, then $0, $0, $1,100, $1,120, $975, $890, $930, and $1,500. So again, remembering that basically the trial work period starts the first month the client earns over $970. What are Gina's trial work period months in this hypothetical? So anytime that Gina earned over $970 would count as a trial work period month. So January, she earned $985, March, she earned $1,500, July, she earned $1,100, August, $1,120, September, $975, and December, $1,500. So all of those months are Gina's trial, would count as part of Gina's TWP, or trial work period months, because she earned over the $970 gross income amount. So has Gina accumulated 9 trial work period months? Take a look at these 12 months and see if 9 of them count as trial work period months. Yeah, and I see people putting no, and that's correct. It looks like they're out of the 2022 earnings, there are 6 months where she's earned over the $970 amount allowed for a trial work period month, but she hasn't used up 9 months, because there's more than, out of these 12 months, there's more than 3 months in which she has not earned over $970. So February wouldn't count, April wouldn't count, May and June wouldn't count, October wouldn't count, and November wouldn't count. So she has not accumulated 9 trial work period months in 2022. Next slide. So let's say a client, Gina or anybody else, actually does use up their 9 trial work period months. They earn over $970 while receiving SSDI. What happens next? What happens next is known as the Extended Period of Eligibility, or EPE. And the EPE is 36 consecutive months. Unlike the trial work period, which can be any month within a 60-month period, the EPE is 36 consecutive months after the trial work period ends. And it's triggered as soon as the person hits that 9th month of the trial work period within that 60-month period. And the extended period of eligibility goes for 3 years out from that first month. So 36 months of an extended period of eligibility automatically following the end of the trial work period. And what happens during the EPE? So during the EPE, again, we're at a point where the client has used up their 9 trial work period months. They've worked over $970. They've worked and earned over $970 a month. And now they're in their extended period of eligibility. What will happen is that the client will continue to get their full SSDI benefits as long as their gross earnings are below the SGA amount. We're no longer looking at the $970. We're looking at the SGA amount, which in 2022 is $1,350. So it's like an on-off or a light switch, on and off. If a client earns less than $1,350 during the EPE, they're going to get their SSDI. If the client earns more than the $1,350, they're not going to get their SSDI for a given month. So the client, again, needs to report this information, their wages, to Social Security, so the Social Security office can know during this individual's extended period of eligibility, is it a month where they earn more than or less than SGA? Are they or are they not entitled to their SSDI benefits this month? So any month the client's gross income is over $1,350, they're not going to get SSDI. That's the light switch turning off. And any month where the client's gross income is under $1,350, they are going to be entitled to SSDI, and that's the light switch turning on. So that's that kind of on-off light switch analogy that we sometimes find helpful when we think about the extended period of eligibility. Okay, next slide. So the EPE is an all or nothing. If a client earns above SGA, it's off. If a client earns under SGA, it's on. They get SSDI or they don't get SSDI based on their gross earnings. So there is a 3-month grace period. SSDI payments continue the first month that earnings are greater than SGA and the next 2 months. So if the client ends their trial work period and they work for a couple of months and they're under SGA and they're getting SSDI and everything's okay, and then they work 1 month and they're over SGA, they're still going to get SSDI benefits for a little bit of time, a 3-month grace period. They're going to get benefits for that month where the earnings are greater in the next 2 months. And then if the earnings drop below SGA during the 36-month extended period of eligibility, the SSDI will restart after the client reports their lower or their no income to Social Security. Now, the problem with this process is that it takes Social Security a lot of time to process an individual's work activity reports and their wages. And so overpayments as well as underpayments can be common. And so what we encourage clients to do is to keep copies of their pay stubs, not only during the trial work period, but also the extended period of eligibility, so they can evaluate and verify whether Social Security has correctly attributed their wages to the trial work period or correctly calculated their SSDI benefits during the extended period of eligibility. So keep records of pay stubs. If your client is working, have them keep their records so that they can evidence that information for Social Security's benefit and for their own benefit. Next slide. So let's do another hypothetical. Let's say Gina does use up her 9-month trial work period, and it expired at the end of last year, at the end of December 2021. And then, so her 9 months are up, she's in her extended period of eligibility, and in 2022, she earns the following amounts at work. She makes $950 in January, $1,400 the following month, then $1,370, $1,400, $1,100, and $850. What months did Gina go over what's known as a substantial gainful activity amount, or $1,350? So in this example, I see somebody putting February, March, April, 3 months, February through April, and that's correct. She went over SGA. She earned more than $1,350 in February at $1,400, in March at $1,370, and in April at $1,400. So based on the information, what months was Gina entitled to an SSDI payment? A little bit tricky on this question. I wanted to highlight what we talked about in the previous slide, which is that there is a grace period. So the month in which a person earns more than SGA, plus the 2 months following it are a grace period in which the person will still get their SSDI benefits, even if they've worked over SGA. So January, she's going to get her SSDI because she did not earn more than the $1,350. Then in February, she earns over $1,350. As she does in March and April. However, this is part of that 3-month grace period in which an individual earns more than SGA, but the SSDI doesn't go down until 2 months following the month in which she earned SGA. So she should still get SSDI for February, March, and April. And then she should notify Social Security that in May, she's actually under SGA again, as well as June. So that again, the light switch can turn back on and her SSDI can be reinstated for those months in which she's earned under the SGA limit. Next slide. So if after the 9-month trial work period and the 36-month extended period of eligibility is over, Gina works again over what the SGA limit, which for this year is $1,350, her SSDI will be terminated. So after that 9 months are used up and the 36 months are used up, as long as Gina's under SGA, she's going to keep getting SSDI. But the month she gets over SGA, there's no more of these extended periods of eligibility or other options for her to keep getting SSDI. The SSDI will stop. However, there is what's known as an expedited reinstatement. So if her SSDI is terminated because her 36-month extended period of eligibility is up, she's worked over SGA, but then suddenly her disabling condition results in her not being able to work and earn over SGA, at any point within the 5 years after the 36-month extended period of eligibility ends, she can apply for expedited reinstatement, which is like a new application for benefits, although it should be expedited or move forward more quickly than a new application, assuming the person can say, again, I was on SSDI, I was terminated after my extended period of eligibility. It's been fewer than 5 years since my EPE ended and my SSDI was terminated, and I still am suffering from the same disabling condition I was living with when I was approved the first time for SSDI benefits. And so if those circumstances are true, then she can file for expedited reinstatement and hopefully get back on benefits a little quicker than a new application, even though it's very similar to a new application. If Gina's expedited reinstatement is approved, Gina will be entitled to a new 9-month trial work period, as well as a new extended period of eligibility if she uses up her trial work period after she's been on SSDI payments for 24 months under the expedited reinstatement application. And that's called the initial reinstatement period. Next slide. Okay, so this is a lot of information, especially with respect to SSDI and return to work rules. That is particularly complicated. So just going to review some of the information we went over. This is poll question number 3. I'm going to launch it right now. And the question is, if a client is receiving SSI benefits but also works, by when should the client report his or her gross wages to Social Security? By which day of the following of the month? Another couple of seconds to let people answer. Okay. I'll go ahead and end poll now so we can move on. Share results. So the correct answer is the 10th day of the month. I think if you're reporting by the 15th day of the month, you're reporting late. And I'm glad to see that nobody said the client doesn't need to report wages at all, because that's not true. The client does need to report wages, and they should do it by the 10th day of the month in which the wages are following the month in which the wages are earned. And then next slide for poll question number 4. I'm going to launch that right now. How many months are in a trial work period for an SSDI recipient? 3, 6, 9, or 12? Okay. All right. Okay, so we'll just stop this because we're running short on time. I'll end poll, share results. The correct answer is 9 months. There are 9 months in a trial work period. And again, those 9 months don't have to be consecutive. It's just any 9 months within a 5-year or 60-month period of time. That's what constitutes an individual's trial work period if they're on SSDI. So as with SSI, it's really important to proactively report wages to Social Security. You can do so by taking your pay stubs into the field office when they open back up. You can report online if you have a My Account on a Social Security. And unfortunately, there's no app for wage reporting for SSDI. So you'll have to either walk it in, mail it in, fax it in. And again, as you would with SSI, an individual should report when work stops if they're receiving SSDI benefits. Next slide. So the bottom line is report the income when it is earned or by the 10th day of the following month in which the income is earned. Don't hide it from Social Security, especially if it's not under the table, because Social Security does conduct periodic work reviews. They'll pull records from the IRS, and they will find out about an individual's taxable income at some point, whether or not the client reports it, and it could result in a very large overpayment for clients and potentially suspension of SSDI or SSI benefits. So report wages. Next slide. Okay, we're going to skip poll questions so we have time for questions at the end. And let me just go through overpayments really quickly. Let's skip ahead and then we'll save questions for the very end. Overpayments can occur for various reasons. They're typically caused if a person goes back to work and earns more than the SGA amount, especially if the person's used up their trial work period. In SSI cases, they are often caused by somebody having a change in living circumstances, especially if they don't report it to Social Security, or if they earn more, have more in income than they typically have, or suddenly gain or end up with excess assets. If they leave the country for an extended period of time, or if they're incarcerated, that can all result in overpayments on SSI. Next slide. So if a person receives a notice of overpayment, they do have the right to challenge it. They don't just have to pay it. We talked about this a little bit when we talked about payees managing clients' accounts or SSDI or SSI benefits. You can do things like file a request for reconsideration if you disagree with the overpayment or the amount of the overpayment. You could say, well, maybe I don't disagree with it. I think I actually owe it back, but I can't afford to pay it back and the overpayment wasn't my fault. I'm going to ask for it to be waived. Or you can say, well, I don't want to challenge it, but I can't afford to pay that all back at once. Let me ask for a revisitable repayment rate. Next slide. So if you're going to file a request for reconsideration, meaning you're challenging the existence of the overpayment or the amount of the overpayment, you have 65 days from the date on the notice of the overpayment itself to challenge it. Again, you can use it to disagree with the fact that you were overpaid, or even just disagree with the amount that you were overpaid. And if your request for reconsideration is denied, you can ask for a hearing before an administrative law judge to further advocate for or argue that you're not required to pay it back. You were not overpaid, or the amount was wrong, and the ALJ can make a decision on that issue. Next slide. If an individual doesn't disagree with the amount or existence of the overpayment, they can ask for a waiver. At any time. There's no 65-day deadline. Anytime, even after you've already begun paying back the overpayment, a client can go to Social Security and say, I'd like to have this overpayment waived, or I'd like to have the remaining balance of the overpayment waived. And a request for waiver can be filed if the client can argue that he or she is not at fault for the overpayment, and he or she cannot afford to pay back the overpayment. Those are the two requirements to illustrate to Social Security that an individual is entitled to a waiver. Next slide. Filing a request for change in repayment rate can also be done at any time after the notice of the overpayment. Again, even if you've already begun paying the overpayment back and you say, this is too much, I can't pay it back at this rate. I want to pay it back at a lower rate. And if an individual asks for a request for change in repayment rate, it should be based on showing Social Security, here's my income, here are all my expenses. As a result, here's all I can really afford to pay back on a monthly basis. Social Security tries to collect SSDI payments back within 36 months. So you can take the total amount of the overpayment, divide it by 36, and see, is that an ideal monthly repayment rate? If somebody owes $20,000 in an overpayment divided by 36, that's a lot of money every month. Maybe that's more than a person can actually pay back. If somebody has an SSI overpayment, Social Security is not trying to collect it in 36 months. They're going to default to a withholding of 10% of the SSI benefits. So if somebody's receiving $1,040.21, they're going to default to taking $104 a month. And so is that an ideal rate for the client to be paying back, or is that going to leave them with not enough to meet their expenses on a monthly basis? And if the client feels that the amount that they're being requested to pay back either for an SSDI or an SSI overpayment is more than they can afford, they can try to negotiate a lower rate, and Social Security will agree to rates sometimes as low as $20 or maybe 40 or 50, again, depending on the client's financial circumstances and what they illustrate they can truly pay back to Social Security. Next slide. So let's do a quick hypothetical. Actually we're getting close to time, so let's maybe scroll through to see if there's any other slides. We can skip the hypotheticals and maybe go to questions at this point.
I don't think we have any outstanding questions in the chat right now, so I don't know if anyone wants to unmute themselves and ask any additional questions.
Hi, my name is Rebecca. I just have a quick question. Can one still receive SSI or SSDI benefits if admitted into hospice care?
Into hospice care. I presume, because I don't believe hospice care provides food or shelter or utilities. Hospice care is really just entitled to give somebody transition and some kind of palliative or pain relief care, and also to assist them kind of end of life quality care. So my understanding is that that wouldn't be providing them with food, shelter, or utilities. So hospice is not a place, right? It's a service. So I don't think that receipt of hospice care should affect or impact a person's receipt of SSI benefits.
Okay, thank you.
While folks think of their other questions, kind of the corollary to that question is if the person were in the hospital for more than a month, though, their SSI might be reduced to a very, very small personal needs amount.
Yeah, and I do see one question in the chat. I think this also might have come up in one of the questions from yesterday. Does the SSI monthly payment change if you move to another state? So that's a great question. The amount that clients are entitled to in California is, for the most part, made up by the federal benefit, but there is in California what's known as a state supplemental payment, SSP. So you'll sometimes see clients in California receiving SSI/SSP. So that $1,040.21 they're entitled to is made up mostly by federal contribution, but partially by state of California contribution. So if an individual receiving SSI benefits in California does move to another state, they need to report that to Social Security. One, so that Social Security has their change of address, but two, because yes, that would potentially is going to reduce how much SSI they're receiving. And I guess it depends on what state they move to. I don't know that all other states or any other states have state supplemental assistance that adds on to the federal amount, but certainly the individual will not be entitled to the state supplemental payment that they receive in the state of California. So their SSI would be reduced if they move out of the state of California.
Next question, when SSI recipients leave the country for longer than 30 days, what happens to their SSI?
Yeah, so they should report that to Social Security, and yes, their SSI would be suspended in any month in which they're out of the country for more than 30 days.
And how do they get it restarted?
As soon as they're back in the country, they should notify Social Security that they're again present and residing in the country, so that Social Security can reinstate their benefits.
And I would add to that, usually Social Security will ask for some sort of proof, like passport stamps or plane tickets or train or whatever transportation they used to indicate the dates that they came and went.
Yeah, that's a great point. Yeah.
So it is a minute past 12:30. I want to thank everyone for attending, participating, asking your questions. Once again, thank you so much, Rachel and Becky, for providing so much information. I learned a lot. I'm sure everyone else did as well. I've dropped the feedback form in the chat. I'll follow up by email. We have a couple more trainings this month, so please keep your eyes out for that. And thank you all so much. Enjoy the rest of your day.